But what I know is that you and Kathleen and others here and outside the room have consulted on, I think, a couple of cases. And Kathleen learned that you were going to be in town and wanted to invite you, and I think you also wanted to come to talk with us about this topic. And from my perspective, this is something that I think we don't consider very often and don't have a venue for talking about that much. So I felt like it would be a good opportunity for us to think with you about this and hear what you've done and what you've learned, so that we can think about it together. So thank you for coming.
Thank you very much for having me, Carol, and also thank you to Kathleen, Dr. Martin, Dr. Rockwell. It's a pleasure to be here. And it's a pleasure to talk to you about something that I think demonstrates what's going on in psychiatry. It will be the next revolution. It's slowly happening. And it's a very exciting time. So talking about tick-borne illness, and as well as any kind of infection that can create a mental problem. Okay, now how do I change slides, or how do we do that? That is one thing. Okay.
Will that move that?
Yeah.
So what do I do?
I'll be your dancer.
So how do I do it?
Carol, how do you do that? I just did the arrow key.
So do I use this to do
I
something?
think Carol's going.
Yeah.
Oh, you're going to do it, Carol.
Dancer.
Okay, the title basically is Tick-borne illness, psychiatric disorders in kids, and psychoneuroimmunology. And I like to think of it as kind of, I wouldn't say not ready for prime time, except I think it is very much ready for prime time in terms of the importance of what this type of infection, where this is all going to lead us for the future of psychiatry. I get no money except for my patients, so I have no financial affiliations with anybody. And just an outline, I'm going to talk first about infections and immune dysfunction in childhood psychiatric illness as well as adults. Then go into more specific details about tics and Lyme's, the neurologic, the cognitive, and the emotional presentations. As well as talk about some work I have done. I've spent a number of years specializing in bipolar kids. And so I go from bipolar kids to tick-borne disorders and mental illness, because I think I have this interest in going for the obscure that, most people won't believe or whatever, I have to prove something. So it's kind of weird. But most of my population that I have treated in the past has been bipolar, and so I was able to do a study on them and looking at tick-borne disorders. Speak about co-infection because these ticks are like dirty needles, and they carry multiple infections. And then what's called, you'll see referred to as post-treatment Lyme disorder. And then some of, okay, next slide. Now, it's very interesting. We think that we're really, scientific and progressive. And then in 1896, if you look at Scientific American, if you can find it, there was an editorial written by two doctors. And the question is insanity due to a microbe? And what they did is they took some cerebrospinal fluid from inpatient psychiatric patients and injected it into rabbits, and found that once they did that, the rabbits then got sick and acted strange. And you have to remember, this is the 1890s, and now they're really talking about infectious agents because we're now starting to recognize them. So they figured, gee, this is kind of similar like typhoid, diphtheria, and other infections, that it could well be that insanity, or mental illness, is due to microbes. And what happened, that was popular until around the 1930s, at which point psychoanalytic theory and Freudian psychoanalytic theory became more popular in psychiatry. that started changing again around the 1950s with the discovery of DNA and has progressed forward. What is interesting, though, is that during this time period, once it was realized that syphilis was caused by a microbe, and they were able to treat it initially with mercury treatment and then with penicillin, they were able to discharge 1/5 of the psychiatric inpatients in the country, which shows you how important an infection can be in being able to catch it and deal with it, recognize it and deal with it, okay? Thank you. So just looking at this association of psychiatric illness and infection, well, there are a bunch of things in the literature that kind of go along with this. If we look at the results from the 1964 pandemic of rubella, the incidence in the groups affected of schizophrenia rose from 1% in the unexposed population to 20% in the exposed population. Clearly, an amazingly significant change. And also, there are enough studies on birth cohorts where we've seen that maternal bacterial infections, viral infections, toxoplasmosis parasitic infections can result in psychopathology in the progeny. Next slide. There was a study in adults, and this was looking at two large groups, large cohort. This one, I think that was in China. And looking at people over an 8-year period of people who were medically healthy, as opposed to those who had a history of repeated low-grade infections. And low-grade infections, we're talking about, you know, your nasal congestion, upper GI upset, nothing major. And the group with the recurrent low-grade infections was more likely in the future to go on to have major depressive disorder. And also, they exhibited poor response to antidepressant treatment, which basically means this group that had a lot of infection goes on to be somewhat treatment resistant. And it may be treatment resistance to me means that we need to look at what we're treating, and we may be treating the wrong thing, maybe missing something else. Okay, next slide. Now, Lund Sorensen looked at the Danish registers of and the Danish are great, so they have registers of over 7 million citizens, and looked at people, and this is actually, slides worded a bit incorrectly. They looked at people that had infections that resulted in hospitalization versus those that had a history of prior infection, but not hospitalization. Some of the words are incorrect on this. But in essence, what they found is that there was somewhat of a dose-dependent increase in the increase in suicide rate. The more times you were hospitalized for infections. And that was the highest peak was in those who were hospitalized 7 or more times with different infections. And we know people are talking a lot about the immunologic changes that occur in suicide. Next one.
So these are just any infections.
Any infection, just plain ordinary infection versus those who were having. Exactly. Okay. And there are a lot of things. If we look at the literature, you know, there are tons of case reports about illnesses, mental illnesses following, you know, Epstein-Barr, herpes, a lot of things. And toxoplasmosis is one of the things that we know is associated with bipolar disorder. And there is some good literature about that. Now, in depression, we do get an increase. It's not anti-inflammatory cytokines. Get rid of the anti. We get the increase in inflammatory cytokines. I think I must have been sleeping when I did this thing because I see all my typos. Anyway, sorry. But some psychiatric drugs we know do have anti-inflammatory qualities, and actually they're using Seroquel in some other types of neurologic disease. And also, antibiotics, we know, seem to be playing a role in psych disorders. I mean, these days, there's a lot of talk about minocycline. And the NIMH is doing a study using minocycline in bipolar depression. And I remember being at a international bipolar meeting a few years ago. And so there were a number of posters about using minocycline. And the thing and all over the world, you know, Eastern Europe, whatever. And I kept saying, wait a minute. Okay, it's working because it's an anti-inflammatory. But what's causing the inflammation? Let's back up a bit. I mean, what is? And I suspect infection is contributing in many places that we just don't know. I mean, inflammation just doesn't, you wake up tomorrow and you have inflammation. So there's got to be something that's precipitating it. And there can be many things, okay? And actually, there are some reports of antibiotics themselves precipitating mania. And I have a few different theories about that, but not now. Okay. And the next two slides I find fascinating, personally. Okay, so you have a man. He's 67 years old. He's mentally healthy, okay? But he develops chronic lymphocytic leukemia, okay? And bone marrow collapse. So he gets an allogenic peripheral blood stem cell transfer from his sibling. Well, his sibling is 12 years younger, but is an HLA match. The sibling also had early onset schizophrenia. So he has been quite ill since early adulthood. Now throw into this story that the sibling also had Lyme 8 years earlier and supposedly got treatment. And as you'll discover, treatment can really vary and not necessarily be effective in eradicating the infection. Anyway, so he had the peripheral blood stem cell transfer. 4 months later, this guy starts showing psychiatric symptoms. He starts showing hallucinations, delusions. He gets suicidal, homicidal, and of course, poor response to psychiatric meds. So basically, something happened in that transplant, transfer. And, and we don't know, was it some type of pathogen? Maybe, maybe it's related to the tick-borne illness. I'm not that impressed by that because he had an early onset of illness. Unless, of course, if you look at the numbers, his Lyme came when he was in his 40s. And I assume it was probably in the 20s that he had his onset, or late teens. Unless, of course, he had tick-borne exposure in the past, and that played a role in precipitating the first episode. So I don't know if it's red herring, in this story or not. But nonetheless, we're transferring schizophrenia from one man to another. Okay, next slide. Then this one is just amazing to me because then you have the exact opposite. You have a 24-year-old person who has really treatment-resistant schizophrenia. Okay, he's really sick. He's got severe hallucinations and delusions. Well, he comes down with another kind of leukemia. He has acute myeloid leukemia. So he gets a bone marrow transplant, and we assume from a healthy individual. Well, after he gets that, he starts showing a drastic improvement in his social functioning. His psychotic symptoms decrease, and not because he's getting, antipsychotics. And these two things are shocking, and it's just, makes you think, my goodness, what is going on with the immune system to make these changes and play a role in these people having mental illness or not. Oh, next slide. And, people are looking for antibodies now all over the place to help us understand different illnesses. And with schizophrenia, there have been found more than 20 different autoantibodies that are present in schizophrenic patients compared to controls. Why are we talking about Lyme? Well, in part it's because I had the privilege of consulting on a young man who was hospitalized here 3 years ago on 2 occasions for a few months and treated with almost every psychiatric medicine I've ever heard of and was still pretty floridly psychotic and was having mood swings too. And I was asked to see him because he seemed treatment resistant. And I said, okay, I'll try, but I really, you know, they're a great place. I don't know that I can add much. And then as I talked to the parents, and when I saw him, there were things that made me think about tick-borne illness, and especially what are called stria, which I will talk about later on. But if you walk away from this talk with only one thing, you remember only one thing, remember this picture. Remember this picture. They look like stretch marks, but they're not. I think people, oh, they didn't get the handout. Oh, okay. Yeah, can you sorry, yeah. You can hand them out. Bartonella stria. I can't tell you how many times these stria have been very helpful to me in diagnosing kids with tick-borne illness. And I've had my arguments with my dermatologist that I totally love. And he's very, very smart. You know, I mean, he diagnosed one of my kids with hereditary angioedema. And he's a dermatologist. And none of the specialists in any field could diagnose this kid's belly pain. And it was him. So, you know, I asked him to biopsy it. And he said, look, you know, Roz, I mean, okay, but, you know, I'm biopsying a stretch mark. Well, it did seem like, he said, you know, the results show there's a lot of inflammation around it. It's not your typical stretch mark, but I don't know what to make out of it. And then I had it sent to this researcher, Marna Erickson, at the University of Minnesota, who does immunofluorescent microscopy on these biopsies. And she was able to show that there was Bartonella in the tissues. And what happens is with Bartonella, you get the stria because you have a higher concentration of the Bartonella in that area. But actually, the Bartonella is present in the other tissues. Okay, so this was amazing. So anyway, so if just remember this, I'm not kidding. Yeah, and the dermatologist will tell you, what are you, crazy? That's a stretch mark. Well, when you see these, you might see them behind the knees or in the upper arms. Of course, you've got to ask if the kid's doing a lot of exercise because that may come into play, or if there have been significant weight gain, or you know, losses or changes. But this is really, it is amazing what these lines can help you diagnose. Now, Lyme is the most frequent vector-borne disorder in the United States and in many parts of the world. And there's a lot we can learn from it. Lyme has been called the new great imitator by Andy Packner. And the initial great imitator was syphilis. And with syphilis, well, syphilis we know could cause many different presentations. It could, you know, have congenital effects. It could affect your eye. It could affect your heart. It could cause dementia. Now, syphilis and Lyme are like cousins, except Borrelia burgdorferi, which is the bacteria that causes Lyme, is like a cousin, but he's an older, smarter cousin, or maybe not older, but he's definitely smarter because he's got a lot more DNA. So he can cause more problems with that. And Lyme can therefore present in many different ways. And if you look at the literature, you can see that. Now, things that they have in common. Okay, so they're both spirochetal diseases, although Lyme, actually, Borrelia can take other forms too. But that I told you, that's the smarter part. But what happens in syphilis? Syphilis, you get a genital chancre. It's there, and it goes away, whether you treat it or not. And that, in Lyme, you get a rash, and I'll show you some pictures, called erythema migrans. You don't get it in everybody. You only get it in some people, if they're lucky. And that, too, can go away on its own. But people give antibiotics then, as they should. And as they should for syphilis. The problem being that many times people thought, well, if you gave the antibiotics and it went away, the person's cured. Well, that ain't true. Okay, that could have happened just on its own. And with syphilis, we know it just stayed sleeping in the body for another 20 or 30 years until the person developed or explored dementia or mania or other kind of neurologic issues. Lyme is similar, except, as I've said, it's kind of smarter. And it can hide in different ways and cause a lot of immune suppression and fool the immune system. And it is something that I think is playing a real role in a lot of the pathology we see. Okay. Now, okay, so then this investigator, he looked in Czechoslovakia and had two different groups. He looked at those who were inpatient psychiatric patients and compared them with, he did age and sex-matched controls and had over 500, pairs. And the other people were just people in general population that weren't in a psychiatric hospital and weren't sick. Well, what he found, those that were psychiatrically hospitalized, he found that 33% of those individuals, 33% of the psychiatric inpatients were positive for Borrelia on one of, they used 4 different tests on everybody, compared to 19% in the healthy population. Well, 33% is a lot more than 19%. So from that, they said, okay, well, it seems like there is this association of Borrelia and psychiatric morbidity, and something that should be considered in an area where Borrelia is endemic, like New Jersey, where I live. Okay, and a proportion of patients may be suffering from the neuropsychiatric effects of Borrelia. Next slide. Well, they took this and then went back and reviewed their data, and they were looking, is there some signal? Is there something in there that will help us be able to differentiate between those that are in psychiatric inpatients caused by infection with Borrelia versus those who are seronegative and don't have it? The only thing they found was that in these psychiatric inpatients in general, it was the younger ones that were more positive for Borrelia as opposed to the older ones. And I think that's very important because what we're talking about a group, mental illness starts a bit earlier than others. And when we're talking about kids, that's as early as you can get. Next slide. And there's talk in the literature, Mueller and Becher in Germany talk a lot about the mild encephalitis concept, the psychiatric disorders. They did a few wonderful papers, and it's really worth reading. They use a lot of things that have been found in the literature and make a very good case for a lot of these psychiatric illnesses being some type of encephalitic process, or maybe a low-grade encephalitis. Excuse me. Next.
Is that particularly like psychotic illness?
Just the cause, mood disorders, everything. And, we've spent many a time talking about nature versus nurture and which one's right, which one's wrong, and then we always come up with, well, it's a mixture of the two. Okay, but for me, I use this organizing principles of what I like to call the 5 I's. How you get sick, if you get sick, will depend on 1, inheritance, your genetics. Genes breed true. I know as I was diagnosing bipolar kids, if I didn't have a family history of bipolarity, I really questioned my diagnosis. Okay, so you've got your genetic predisposition. Then what happens is you get an insult. An insult can be an infection, could be head trauma, could be some metabolic disorder, but something that then changes your system. Now, your first response to any sort of trauma infection will be inflammation. And we all know that's the buzzword in all of medicine today. Everything is all about inflammation. And like I said, what's causing the inflammation is not necessarily always asked. But okay. And once you have, and the inflammatory response is so important because of part of how people recognize that there was immune problems in depression was the overlap, in a sense, in the presentation. What happens when you get sick? Your sickness response typically is one where you're much more tired. You want to be left alone. You have a decreased interest. You probably want to sleep more. It's hard to concentrate. You don't feel well. You just want to stay in bed. And so these similarities cause researchers to think about the immune system being involved with mood disorders. Well, once you get the inflammation, then you get immune dysfunction. And we know we have a lot of autoimmune difficulties today, and a variety of things can happen. And an overactive immune system is one of the problems we have. But following the stepwise thing, but also with arrows going back and forth and all over the place, because that's really how it goes in life, the end result is illness and mental illness. Now, so I'm not saying all mental illness is due to infection. Absolutely not. I would think that would be foolish. But I do think there is a certain proportion that may well be. But it's very interesting if you treat kids with tick-borne disorders, they have a lot of similarities to children that get head injuries in sports. Okay? And again, because you're setting that cascade going. Okay. Oops, next. Okay. And what has concretely, I think, made us think more about the immune system, infections, and psychiatric illness has been the work by Susan Sweeto at the National Institute of Mental Health. She was looking at kids with streptococcal infections and the effects on creating rheumatic fever. And we know it can have lots of different effects. If you have a strep infection in certain predisposed individuals, and there is a genetic component to that, you may wind up with glomerular nephritis, kidney disease, or you may wind up with Sittingham's chorea, a movement disorder. You, of course, could get different types of arthritis and affect your heart valves, so a carditis, as well as valvular problems. Well, when she was doing this, and looking at these kids, a lot of them seemed to show some psychiatric symptoms. And if you go back and read what Sir William Osler wrote back in the 1880s, when he talks about rheumatic fever and strep, he describes a lot of the kids having mood changes, irritability, and obsessive compulsive symptoms. And that was striking to Sweeto. And so what she wound up coining the phrase or the clinical diagnosis of PANDAS, pediatric autoimmune neuropsychiatric disorders after streptococcal disease. Now, with that, people also noticed that kids with other infections started having psychiatric symptoms after infections, and that wound up being called PANS, pediatric acute onset neuropsychiatric syndrome. And actually, PANDAS is a subheading under PANS, which is the more general term of saying we don't know what caused it. It could be something metabolic. or traumatic or infectious. But in both of these illnesses, what you get is the acute onset. The kid wakes up one day and is suddenly like possessed. He is different. Parents will say, it's not my son. He's become much more oppositional. He has a lot of obsessive compulsive problems. Or he's developed a lot of tics, which he didn't have before. He's more irritable. He has changes in his ability. He can't focus as well. He almost looks like he's an ADD kid, although he didn't have that before. And so they notice a whole variety of symptoms. Now, I think people now admit that the P for pediatric is a bit of a misnomer, since you do get these in older people too, not just kids. Okay. And no, I was just going to say something else, but okay. Well, that's okay. Sorry. Oh, the onset and the course of a pandus and in PANS often is what they call a sawtooth pattern. Okay, the kid gets sick, he gets better, but he may go back to baseline, but he may not. And then what happens? Often they're exposed to something else and not a strep. But that triggers their immune system. And again, they get symptoms. And then they calm down. Okay. So as I looked at this, and you can change slides now. And I looked at PANS, which I said is the more general thing. What do you call it? I realized, gee, if you look at all the symptoms, they sure sound like my bipolar kids. And I actually wrote an article about that in Neurology, Psychiatry, and Brain Research in 2014. Because really, you can see all of the symptoms in bipolar kids. These kids with the acute onset of illness, often they don't go to school because they have tremendous separation anxiety. In a bipolar kid, when he's depressed and young, often you'll see anxieties are almost before you get the real mood swings. But they'll have a lot of separation anxiety, and they'll have a lot of problems going to school. And when I went through this whole list of symptoms, the only thing that really differentiated them was that kids with PANS have urinary problems. And so they may regress and have bedwetting or daytime wetting or go more frequently. And that you don't see in bipolar kids. But all of the other things can be found in these kids. So that kind of really intrigued me. You know, I mean, they look the same. So what's going on? Well, so what I did is I started getting panels on kids for PANS and PANDAS and whatever. And not just strep, though. Typically what you do is you look for Lyme and other things, as well as Mycoplasma pneumoniae. Okay, well then, more of the kids in my practice had Mycoplasma. They were positive for Mycoplasma than they were for strep. Well, that was strange. Okay, and actually, there is an immunologist that I work with that would treat these kids, and when he treated them for the Mycoplasma, they got better. But still, I felt the puzzle was incomplete. And then one day I heard that ticks carry Mycoplasma. Who knew that? And our testing is not so good. So if you get the different serologies, you could have a different type of Mycoplasma test out positive, and it could be like Mycoplasma fermentans, which causes Gulf War disease. That's causing your positive in your just general testing of your kid. Not that I'm saying your kid has Gulf War disease. But I'm saying that there were just hints that, wait a minute, maybe these ticks are important. And so I started learning more about tick disorders. And the more I got into it, the more I found. And the more kids I found with this. And that to me was a whole different world. Okay, let's go to the next slide. And these are the symptoms with pediatric bipolar and PANDAS. As I said, if you get my article, it's all in there. Okay, next slide. So Lyme, what is Lyme? Well, it's caused by this bacteria, Borrelia burgdorferi. Now the symptoms, your typical symptoms, are going to be a bullseye rash, which is one of the handouts I think you have that just shows you pictures, but they're really not all bullseye rashes. And many kids really don't have a bullseye rash. So if you're lucky, your kid has a rash with the tick bite. Along with that, they get a little sick. So they may have a bit of a fever, a headache, joint pains, muscle aches. Well, unless you've seen a tick with that, who is going to think the first time, oh my God, it must be Lyme? I mean, kids are this way all the time. You're not going to think of one if you don't see the classic rash, which does not occur in a significant number of people, and if you don't see a tick, okay? And then you get into a whole area of controversy. But if you look at the literature, most of the literature that exists is around adults, and it is around the acute onset of Lyme disorder. And the truth is, if you're treated acutely and aggressively, you've got a pretty good chance of curing it. But for many people, even with treatment, and we don't even know what good treatment is, and I can explain that later if there's time, 10 to 30% of them develop what is called post-treatment Lyme disorder syndrome. And that means the cognitive fog, just generalized fatigue and weakness or paresthesias, things that are very hard to document in an objective fashion, but are enough to stop people from living life and have to give up their jobs, or kids not go to school, and really creates a lot of problems. Okay. This is each dot's supposed to be per case, or whatever. You see it's really on the Northeast, the upper Midwest, and recently it's clear that it occurs. You can get Lyme in all 50 states of the United States. Okay. So I looked up Lyme in Seattle, and what I found from the Washington State Health Department is that there are anywhere between 7 and 23 cases among Washington residents each year. Now, the real number, because they use very narrow criteria, generally is multiply that by 10. So even 70 to 230, not great, but it's not that high as in other places. But if you read what they say, most of the people got it from traveling. They got it from other places. We don't have it here, not much, maybe 0 to 3 cases. And this is really, it discourages people from looking, and especially at a time when our tests are really not good. And you've got to wonder how many cases we're missing. There are, the most recent estimate by the CDC was 426,000 new cases of Lyme. 2018, I guess, the newest statistics. Next slide. And if you look at the ticks, I mean, that's the size of a tick next to a dime. Okay? That is how tiny they are. They are so easy to miss. And, they swell up as they eat and as they get older. But, they can cause illness at just any time they're doing their blood feeding. And typically what they do is they like birds and squirrels and mice. Mice are very popular. And man is more the accidental host. Mice are really resistant to it. So if we could figure out why the mice are okay, it would really help us. Okay, next slide. Okay. Well, if you talk about Lyme in kids, according to, these are the 2017 statistics from the CDC. Basically, children under 18 make up a quarter of the cases. Okay? And why is that? Well, think of it. The kids are very close to the ground. Okay? They're short. They're playing in the woods, rolling around in the leaves. They're much more likely. Recess, they're out and about in the outdoors. They're much more likely to exposed to these low-lying, vectors, and they can cause significant morbidity. And if you look at the slide, I mean, you see the peak is in boys between the ages of 5 and 9 years old, which makes perfect sense. And then there is another peak later in life between like 55 and 65. But, I'm saying the kids make up 1/4 of the cases. Well, if you look at all the literature online, that is not what is about children. There's a lot less. And what does exist is mainly focusing on arthritic complications. And that has to do with the initial discovery of Lyme. Lyme actually existed in Europe and existed in the world for quite a while. But what happened was in the 1970s, this mother, Polly Murray in Lyme, Connecticut, noticed that there were suddenly an outbreak of like multiple cases of juvenile rheumatoid arthritis in her area. So she reported it to the health department, and they sent investigators to check it out. Alan Spear, who's a rheumatologist, who had finished his training and was at Yale, I think, at that point, and another colleague went to check this out. And they thought that they had discovered a new illness. But remember, Spear was a rheumatologist. And if you think that this is a rheumatologic problem in the joint, like rheumatoid arthritis, there's no role for any antibiotic. So it really wasn't until Willy Bergdorfer, who is the person who found that it was this bacterial infection in ticks that caused the illness, that it was clear that antibiotics were really needed. Okay. Now, how devastating can Lyme be? Well, the CDC looked at 64 school kids, and you can see these kids were home a lot. They missed a lot of school. They had a decrement in grades because of the cognitive effects you can have with it. So it really can cause major problems. Next one. Okay. And with Lyme encephalopathy, which you can get in kids and you get in adults, it's going to affect memory, attention, especially slowing processing speed. And the good thing about us working with kids is we often have reports from schools that test them and then test them again a few years later. And it's great if you can then go back and see, because in some kids you'll see the processing speed went from 50% to 3% over a few years. Does that make any sense? Well, there's an infection there. Okay, and with the encephalopathy, you can get sleep. Sleep problems are very common in these kids. And it's like, I think, with most psychiatric disorders. You got to get the sleep right for them to feel better, and them feeling better will help the sleep be right. Okay, next slide. Okay, and Lyme, the bacteria is neurotrophic. It loves the nervous system. Okay, and kids, because they're close to the ground, they're bitten more around the head and neck. And kids are more likely to have central nervous system effects from Lyme. And they have very few peripheral nervous system effects, unlike adults who can show a lot more. Okay, next slide. Well, and two hypotheses in what I wonder. In youth with neuropsychiatric symptoms, how many of them actually are kids with tick-borne disorders that we're misdiagnosing? And could it be that, well, we all know about the arthritis, but could it actually be that the most common presenting symptoms of tick-borne disorders in kids is in the neuropsychiatric field? Okay? When you look at the neurologic symptoms in children, Deborah Bellman did a study at Stony Brook and looked at 94 youth that presented to a neurologic clinic that had diagnosis of Lyme. What found is the most common symptom in that group was 71% had headaches. The next most common was Bell's palsy. and that was only in 14%. Okay? Significant difference there. Okay, and if you get a kid, especially in the summer, sudden onset of Bell's palsy, or especially if it's bilateral, you think Lyme. Okay. So if you look at the studies done on kids, mainly the studies were looking at cognitive issues. But, like this study was done by Taker and Fallon over at Columbia. And they had 20 kids, they had a control group, kids with, they thought were chronic Lyme, and did a variety of testing on them, as well as did questionnaires. Well, what they found that mood symptoms were present. The parents rate around 40% of these kids had depression and suicidal thoughts. And the kids' rating was actually the same. 40% of them admitted to having suicidal thoughts. Well, that's a high number in such a small group. Okay, so there clearly something's going on here with mood. We may not have addressed it, and that's not what the study was about. But you have to wonder. Okay, next slide. Okay, and in Bellman's study that I told you, where she did neurologic Lyme, 94 kids, it also kind of found that 36 of those 94, or 38%, showed behavioral and mood changes. Okay? Not that different from what I just told you about in the cognitive study. Okay. And another study, Fallon looked at results that he had from something else and found that these kids with chronic Lyme had higher rates of anxiety, mood, and behavioral disorders than those that didn't have Lyme. Next slide. And Lyme can, since I said it's the new great imitator, it can present it as any of these psychiatric disorders. Okay, that's just the reality. Oops. Yeah. So, quickly just going, next one. Okay. Well, so we see that tick-borne illness is associated, at least in case reports in some of these studies, with a lot of psychiatric symptoms. But what about looking at psychiatric patients? And because I'm a specialist in pediatric bipolar disorder, I had a population that all had a certain, diagnosis, and I was able to look for tick-borne disorder. And the more I got into PANS and PANDAS, I started testing all my kids for these different disorders. And the results were really amazing. We can go into the next one. So basically, I took 27 kids in a row. They're consecutive from my practice. The average age was 7. 15 bipolar 1s, 12 bipolar 2 by DSM-4 TR criteria. These kids were all tested for tick-borne illness, and they were tested by standard labs as well as what are considered boutique labs. But the truth is those other labs may be better, and that's the issue. Okay, next slide. Okay, that's what it looks like on a chart, and you'll all be getting slides, a copy of the slides so you can see this. Next slide. Basically, what I found is that 16 of these kids, 27 kids, were positive for Babesia. Babesia is a parasite that's like malaria that gets carried by ticks. Mycoplasma pneumonia, 11 positive. Bartonella. Bartonella is an infection that occurs really if you've got an immunocompromised host. And we really never knew that much about Bartonella, except that it was involved with cat scratch disease. But once AIDS came about, you had a large immunocompromised population. And so they came down with Bartonella a significant number of the time, especially a lot of people had cats. And so we have started to learn a lot more about Bartonella. I remember those are those stretch marks, funny stretch marks that I showed you. Okay, 6 kids had Lyme, and it's a matter of you use the boutique lab, which happens to be better. Identics lab, that one tests for not just one strain of Lyme like LabCorp and Quest2, but 2 strains. Well, it doesn't take much of a brain to realize if you test for more than one thing, you're more likely to have more positives. But okay. And you can get anaplasma and Ehrlichia. Next slide. Okay, so basically what I found that 89% of my kids were positive on some serologic testing. Then I took those kids and I told each parent, look, I'm not going to diagnose your child with Lyme. I'm not a regular medical doctor. I really wanted to see somebody who knows Lyme. And so I gave them referrals. Most of them took it. And those that did, 92% of them found that the doctor agreed that these kids have tick-borne disorders. So basically, 3/4 of my bipolar kids were diagnosed with a tick-borne disorder, and around 1/4 had pandas. Next slide. No, infectious disease people are trained to not believe in chronic Lyme. People who are, well, they're called Lyme literate doctors, but it's doctors that I know that really started medicine, they're family practitioners, immunologists. Rarely you get an infectious disease person who does understand the illness and is willing to look at the labs and interpret it and be more flexible in how they diagnose it. If any of my kids, I tell the parents, you know, you can go to anybody you want, but do know if you go to your pediatrician and you go to your infectious disease doctor, they are trained not to recognize that, dismiss these labs, and just say it's not true. And that's a whole another area. Anyway, then I went and just looked at my consecutive patients over a 3-year period. And I found that those that got the specialty labs, just about all of them were positive. Those that just got the regular labs by LabCorp Quest, 7 were negative. Okay, and some of the kids got referred to me because they had tick-borne illness, and 7 parents didn't want testing. Whatever, it's a significant number of kids that at least that I'm seeing. I know I'm in a Lyme endemic area, but you know, to me it sounds like more like the Lyme epidemic area than endemic. This is my practice, and quite honestly, I kept getting these results, and I kept thinking, how can I tell anybody this? This can't be true. I mean, it just seemed too absurd. When do you see so many people test positive for something? And actually, what I did is when kids were getting 2 positive tests, okay, like the Bartonella test that I told you about from the specialty lab, Galaxy, I tested myself. I paid money. I used my married name so they wouldn't know it was me. I had a positive titer. Yeah. I called up the head of the lab and I said, look, what is this? And I said, look, Rosalie, you gotta know, sometimes, you know, it's a newer test, you're gonna get false positives. Why don't you do it again for free and do what we call a triple draw with 3 bloods within a week to look for PCR testing for evidence of Bartonella as well as immunofluorescent assay and serology. My serology was even higher. Well, this is ridiculous. So either the lab, there's something wrong with that lab and everybody's positive, or I really have Bartonella, even though I don't have any symptoms. And because I knew from my 2 patients that had the immunofluorescence stain biopsy, that when they had Bartonella, it was also present outside the stria, I decided to get myself biopsied. And I have Bartonella in my tissue. I can show you pictures of it. So I do not question that test. It's pretty good. Why am I not sick? Then people say, you're getting treated with this, that. I don't have symptoms. And my thought is, hopefully it's because I'm immune competent. Now, if I get immunocompromised, I could be at risk. But at this point, no. And if you look at the slides, you can see that my vasculature and the collagen looks pretty good, even though the infection was there. Okay. Anyway, the 2-tier tests that we have now are lousy. Show the next slide. Basically, okay, the sensitivity of the way it is now using the regular 2-tier testing. The study reviewed a bunch of studies. The sensitivity of the testing is 56%, which means you're missing almost half the kids. In that first part, it's a 2-part test. So at the beginning, you're missing a significant number of kids. The specificity is very high, but you want to be able to pick up, you know, as many cases as you can. And if we look at AIDS, you know, AIDS testing has a sensitivity of 99.5%. Who would would accept an age sensitivity test at 56%. I mean, you just wouldn't. And that is a real problem that people have been starting to acknowledge. Okay, next slide. And also the problem is when you get tick-borne infections, ticks are dirty needles, and they can carry tons of pathogens. The most common, at least my area, Babesia and Bartonella. And that complicates the picture because they can cause neuropsychiatric problems. Next slide. And Babesia can cause depression and anxiety. Bartonella, people think about Bartonella as Bartonella rage. It's really associated with a lot of psychiatric dysfunction, especially rage. Okay, just the thing, post-treatment Lyme. Okay, that I just want to tell you. Post-treatment Lyme means after somebody gets treatment and they still have symptoms. Now, why they don't call that chronic Lyme is beyond me, and it's stupid. It's a misnomer. Okay, but because the symptoms were the type that were more subjective and could not be objectively measured, they were able to be somewhat poo-pooed in the literature. Until now, just recently, there was a study done using PET scans in 12 individuals, and this is adults, but 12 individuals with this post-treatment Lyme disease. Okay, and that is, you have a copy of those PET scans, and basically what you see is the people who had post-treatment Lyme, the brains are full of inflammation. It is significantly different from healthy controls. So now we are starting to see the objective evidence of what patients have been telling us for years. And so just in the last slide, just in summary, I wonder if the initial presentation of tick-borne illness in youth is to us as psychiatrists. And it's something I think one has, if you don't keep it on the radar, you're never going to see it. The relationship between tick-borne and bipolar to be continued. But there's no question, we need a lot more research because it's affecting a lot of our kids. And if you affect them early in development, that affects their whole life. And when I stop.
Yeah, I think the hard part is it's hard to know what the baseline is in the population. Like if you're getting, 100% or 90% of your population of psychiatrically ill kids, does that mean it is also the case that it's
which is an excellent point. I have had the experience, though, of watching many of my kids get treated with antibiotics or various immune interventions. And I've seen them get better than I could have ever imagined in my life. I had one boy, he was 10 years old. He was hospitalized 4 times at age 10 because he was suicidal and homicidal. Okay? They gave him everything. It was just, and then he came back. Then I became his doctor. And I figured, what the heck? I'm going to test him. And his mother said, this kid never had a strep in his life. His ASO titer was over 800. And actually, once he got treated by my immunologist friend who hit him with a lot of antibiotics, 3 months later, I had a kid come into my office who was a different human being. For the first time in his life, he wanted to do homework. He wanted to do well in school. He said, thank you, Mom. He showed affection. Dramatically different. So I've seen what treatment can do. Not for everybody. I think you have 3 different groups. One group, they get the proper treatment and they don't need psychiatric meds anymore. At the beginning, I think they do need it if they're presenting in this way. Then you have another group that they'll need less psychiatric meds, but they'll still need some. And then you'll have another group that need the psychiatric meds no matter what. So, but I know what I've seen, and if I didn't see it, kids get better. Where they never got better before, it kind of is amazing. And Ian's a very good example, their son, because he was psychotic and he was agitated and his mood was shifting and he was out of control and he basically talked to his hand and couldn't talk to you and was like in outer space. And now you can see this boy can think, he can hold conversations and has an incredible command of information. Is he where he should be? Absolutely not. But he has made, there is no question of the progress he has made from where he was when I first saw him. And he's continuing to get intervention. The problem with this disorder is at the beginning it's real easy to fix, but the longer it goes on, it sets a whole bunch of things in motion. Probably your body of minerals, vitamins, it just changes things so dramatically, and that's much harder than to take care of. So, yeah. So I hope you'll put this on your radar, basically.
We need to study. Yeah.